everybody. We're going to do a little bit more notes today on the circulatory system. We started these notes last week, if you guys don't remember. We either got through 3 or 4 depending upon the class that you're in. So I'm actually going to just start with Roman numeral 4, which is essentially talking about the left side of the heart and the systemic circuit. So just follow along, fill in what you need to fill in. I learned from my video yesterday that I can't make the videos too long because they need to be compressed and they take forever to upload. So I'm going to be a little bit brief here, but do what you can, and you always have access to these notes on Canvas. So when blood is returning from the lungs, it is going to enter the left side of the heart via the pulmonary veins. Remember that veins are always going to be bringing blood back to the heart. And the blood is going to be entering in on the top chamber, the atrium, so it'll be the left atrium. And the blood will then travel down past a valve called the bicuspid valve. The bicuspid valve, remember, is the second valve we've talked about. The left side was the tricuspid. You have to ride a tricycle before you can ride a bicycle. I should add before I continue that the blood that's coming from the right side, the right lung, is going to come back behind the heart. So if you want to think of it as like a dotted line, the blood will come and enter into that left atrium, but you might need to kind of depict that with a dotted line. And I think we did that on our diagram yesterday. So anyway, when the blood passes through the bicuspid valve, it's going to end up in the left ventricle, and then it's going to take an upward turn and go through the aortic valve. The aortic valve and the pulmonary valve are often collectively called the semilunar valves, but I am not going to ask you about that term. And then the blood will be leaving the heart through the largest artery of the body called the aorta. Up here, the blood is going to be traveling to the head and arms, and then the aorta will hook downward and continue down to the lower half of the heart, and that is called the descending aorta. And I think we labeled that again yesterday. And all of that is outlined in this paragraph up here. So to go on to the next page, this is new information. How does the heart tissue itself get oxygen, as well as remove urea and carbon dioxide from its own muscular tissue? The fascinating thing about that is the heart does not actually extract oxygen from its own chambers. It has to have its own blood supply. So those are called coronary vessels. So the arteries are called coronary arteries and the veins are called coronary veins. The arteries will branch off from the aorta, and the veins will dump back into the vena cavas, especially the superior vena cava. But I'm going to focus mostly on the arteries because it turns out that it's these arteries that often are involved with heart attacks. So there's 2 main coronary arteries, the left and the right. You can see them in the picture down below. And it's when these arteries that actually get narrower due to dietary issues, cholesterol, fats that people eat, but sometimes genetics play a role. The heart tissue can be slowly robbed of oxygen, and if that's left to unfortunately its own devices, the heart can stop, and you guys know that as a heart attack. So again, that's kind of outlined here. So a lot of times I think kids think it's these very, very large vessels, like an artery like the aorta that gets clogged, but that's not the case. It's these coronary vessels. And if you were lucky, you would have seen them stained on the surface of your pig, but they were also shown in the binder when we did the pig as well. So the pictures down below have a real nice overview of circulation. you can see that the right side of the heart is going to be receiving blood from the lungs, the body, the liver, the kidneys. Keep in mind that blood leaving the kidneys is going to be cleaned. It's going to be lower urea, but it's also going to be low in oxygen. Blood leaving the liver, it's going to be clean, but also low in oxygen. And that blood needs to actually have another push to go to the lungs to pick up oxygen and drop off carbon dioxide, come back to the heart, enter in on the left side, and then get another push to go to all the tissues of the body, some diverging to the digestive system, some of the blood diverges to the kidneys, some of the blood diverges to the body. And then again, the picture on the bottom right just goes over the structures of the heart one more time. And again, you can rewatch the video that I showed yesterday that shows circulation there. The last page of the notes just goes over blood pressure. I'm not sure if you've had your blood pressure taken, but I bet you have at some point in your life. Even my 7-year-olds have had their blood pressure taken. And so when you're checking your blood pressure, the nurse or doctor is looking to see at what pressure is your blood putting against the arteries either during a beat or in between beats. And those measurements are actually 2 different measurements. So the top measurement in blood pressure is called the systolic measurement, and the lower or denominator measurement is called the diastolic number. The systolic number, so when you depict blood pressure, it's actually kind of represented like a fraction. The systolic number goes on top, and it is the measurement of mercury that your blood is putting up against the walls of your arteries when your heart is contracting. So it's actually forcing the blood to be moving fast through your arteries. And so since it's putting more pressure on your arteries because the blood is moving, it is actually going to be a higher number. And then the denominator is the diastolic number. So what I do is I remember diastolic denominator. They kind of both have D's, so it might be easier to remember. And the diastolic number is the pressure that your blood puts on an artery in between beats. So it's kind of like in between when you hear your heart go lub-dub. That pause is when the diastolic number would be taken. So you'd have a lub-dub, pause, lub-dub. The number up here would be like a 117/76. And you might be wondering, well, then what are normal blood pressure measurements? And those are actually listed down below. I'm not going to ask you to memorize these, but I might ask you what's a normal blood pressure and maybe what is an at-risk or even a in crisis blood pressure on a test. I do think that you should know that typically your blood pressure is going to be somewhere around 120/80, and that's considered to be a normal range. But, and you know, when you creep up in your systolic and your diastolic numbers, then blood pressure is kind of telling the doctor that something's kind of going on and maybe we want to monitor this. However, things like stress and exercise can also play a role in your blood pressure. So it's not always the fact that maybe you're not taking care of yourself. It's just maybe some things going on with you either during the day or in your life that might affect your blood pressure. But that said, you guys are young, and most kids are going to be reading right around 120/80. Okay, so that's the end of the notes. Thanks for watching, and I hope you got everything filled in today, and I'll see you next time.